You wake up in the morning with that bone-deep fatigue that just won't quit, even after a full night's sleep. You look in the mirror and notice your belly seems bigger, more bloated, and that heavy feeling on your right side just won't go away. You go to the doctor, get your routine checkup, and they look at you with a reassuring smile, saying everything's normal. It's just age creeping in. It's natural. But deep down, you know something's not right. You feel your body screaming for help, crying out for attention, but the tests say everything's fine. And then comes that quiet dread, that feeling of going crazy, of maybe you're overreacting, being dramatic. You head home, carrying this doubt, this fear that no one validates, this worry no one takes seriously. Meanwhile, your liver is literally drowning in fat, becoming inflamed, slowly progressing towards fibrosis, maybe even cirrhosis, and no one's seeing it because everyone's looking in the wrong place. This is the reality for millions of people over 50 who are developing fatty liver disease right now and don't even know it. Not because they haven't had tests done, but because doctors are focusing on the wrong test, the wrong marker, the wrong information. And when they finally discover it, it's often too late. The liver is already advanced with fibrosis, already scarred, already lost part of its ability to regenerate. And all of this could have been prevented if someone had looked in the right place at the right time. Today, I'm going to show you exactly what mistake most doctors make, what test you need to ask for, and how you can find out if you have fatty liver disease before it's too late. Because I'm not going to let you become another statistic, another person who finds out when there's not much left to do. Before we go any further, let me introduce myself. I'm a hepatologist. I've dedicated my entire career to studying the liver, to understanding how this extraordinary organ works, how it gets sick, and more importantly, how it heals. I've spent years in my practice seeing patients come in scared, confused, feeling like they've been let down by the healthcare system, and I decided I needed to do something bigger. That's why I'm here, on this channel, bringing you quality information based on science, on recent studies, on solid evidence, but translated into language you can understand and apply in your life. I want you to leave here knowing exactly what to do, how to protect yourself, how to take care of your liver before it collapses. If you're here with me now, it's because you care about your health, because you don't want to be just another number, another patient who accepts any diagnosis without questioning. And that fills me with hope, because people like you are the ones who can truly reverse serious conditions, who take the reins of their own health and transform their lives. I created this channel thinking exactly of you, to give you the tools that many doctors don't have time to explain in their offices, to show you the details that make all the difference between staying sick and finally getting well. Every week I bring you new content, updated protocols, research that's just come out, information that will put you ahead of the curve. So subscribe to the channel now and hit the notification bell, because I promise I'll be here week after week guiding you on this journey. You don't have to go through this alone. And together we're going to reclaim your liver health. We're going to reverse this condition. We're going to give you your life back. Now let's get straight to the point, because I know you're eager to understand what's going on. But before I reveal the test you should be asking for, I need to tell you a story that will make you understand the gravity of this medical error. Let me tell you about Marcia, a patient who came to me a few months ago. Marcia is 62, retired, and has always been an active woman, health conscious, the kind who never skips a doctor's appointment, who gets her annual checkup religiously. She told me that for over 5 years she'd been feeling tired, with that abdominal heaviness, struggling to lose weight even when dieting, but every year her doctor would look at her tests and say everything was perfect. Her liver enzymes, the AST and ALT, always came back within the reference range, so according to traditional interpretation, her liver was healthy. Until one day Marcia started experiencing more intense abdominal pain, bloating that wouldn't subside, and finally her doctor ordered an ultrasound. And then came the shock, grade 3 hepatic steatosis, meaning over 60% of her liver was taken over by fat. Not only that, the elastography showed signs of significant fibrosis. Her liver was already starting to scar, to harden, to lose its full functionality. Marcia looked at me with tears in her eyes and asked how this could have happened if her tests had been normal all these years. And here's the mistake most doctors make, especially when dealing with older patients. They focus exclusively on liver enzymes, on AST and ALT, and assume that if these values are within the normal range, the liver is fine. But here's the truth no one tells you. AST and ALT are markers of active liver injury, of acute inflammation, and not necessarily of fat accumulation. You can have a liver completely infiltrated with fat. You can be developing severe steatosis and still have normal or only slightly elevated enzymes. This happens because fatty liver in its early stages doesn't cause enough intense inflammation to make these enzymes spike. It's a silent, insidious process that progresses slowly without giving the signals doctors are accustomed to looking for. And meanwhile, the liver keeps accumulating more and more fat, loses function, enters a state of increasing insulin resistance, and by the time the obvious symptoms finally appear, it has often progressed to steatohepatitis, to fibrosis, to something much harder to reverse. Now I need to pause here and ask you a very important question, and I want you to be absolutely honest with me, because your answer might help thousands of other people watching right now. Have you ever gone to the doctor, had tests done, and been told everything was normal, but still felt like something was wrong? That unexplained fatigue, that abdominal heaviness, that difficulty losing weight, that feeling your body is trying to warn you about something, but no one is listening? Have you ever felt invalidated, ignored, like you were making symptoms up? I know exactly how that feels, because I see it every day in my practice. People who have spent years being overlooked, treated as if it's all in their head, all in their imagination, when in reality there's a real tangible problem happening inside their body. So I want you to comment below right now. Use these words if you want, or write it in your own words. My tests always came back normal, but I feel like something is wrong. Don't be afraid. Don't feel ashamed, because this is a space of support, of truth, of validation. When you comment, you're showing other people that they're not alone, that they're not crazy, that what they're feeling is real. You're creating a network of support, of collective strength. Comment now, because I read every comment, every story, and your voice matters. What you're feeling matters. Now, let's dive deep into the science behind all of this, because I want you to understand exactly what's happening in your liver when it starts accumulating fat. The liver is an extraordinary organ, responsible for over 500 different metabolic functions. It processes everything you eat, filters toxins, produces bile for digestion, stores vitamins, regulates blood sugar, synthesizes essential proteins, and so much more. When you consume more calories than your body needs, especially in the form of refined carbohydrates and sugars, the liver converts that excess into fat and starts storing it within its own liver cells. In the beginning, this is reversible. The liver has an incredible capacity to regenerate. But when this accumulation becomes chronic, when you spend years and years maintaining habits that overload the liver, the fat starts causing inflammation. Liver cells become stressed, they start producing free radicals, the immune system is activated, and you enter a state of steatohepatitis, which is basically inflammation of the liver caused by fat. And then, if nothing is done, the liver tries to protect itself by creating fibrosis, which is scar tissue. The problem is, fibrosis doesn't work. It doesn't do the job the liver needs to do. It's just a scar that hardens the organ, reducing its capacity until eventually you can reach cirrhosis. And here's the crucial point you need to understand. Throughout this entire process, especially in the early years, liver enzymes can be completely normal, because AST and ALT measure the amount of enzymes that leak from liver cells when they are actively being destroyed. But in the case of fatty liver, especially in older individuals, the process can be slow and steady without causing acute cell destruction. The fat is there, the inflammation is there, but at a low, constant level that doesn't make the enzymes spike. It's like having a slow water leak in your house that's gradually soaking the walls, rotting the structure, but not causing a dramatic flood. If you're only looking for floods, you'll never discover the leak until the house collapses. And that's exactly what happens when doctors focus solely on AST and ALT. They're looking for the flood, but missing the leak that's silently destroying your house. Let me tell you now about another patient, Roberto, who had a completely different journey than Marcia. Roberto is 58 years old, a businessman, a busy life, high stress, irregular eating habits. He was always the type who only went to the doctor when it was absolutely unavoidable. But his wife insisted so much that he finally got a checkup. And guess what? AST and ALT were normal. Cholesterol was a bit high, but nothing alarming. Blood sugar was borderline, but not yet diabetic. The doctor told him to relax, eat a healthier diet, but that there was nothing to worry about. However, Roberto's wife, who is a nurse, was bothered by the size of his belly and his constant fatigue and insisted he get an abdominal ultrasound. And that's when they discovered grade 2 fatty liver disease, with over 40% of his liver already accumulating fat. Roberto was in shock because he thought if his blood tests were normal, everything was fine. But the truth is, he was on a direct path to a very serious problem, and if it hadn't been for his wife's insistence, he would have continued ignoring the signs until he developed something irreversible. So, what's the test you really need? It's an abdominal ultrasound with specific liver evaluation, or even better, a liver elastography. The ultrasound can directly visualize if there's fat accumulation in the liver. It can classify the grade of steatosis. It can see if there are signs of fibrosis or other structural changes. And elastography is even more precise because it measures liver stiffness. It can quantify the degree of fibrosis, giving you a very clear idea of how much damage has already been done. These tests are non-invasive, fast, accessible, and infinitely more useful than simply looking at liver enzymes when you're trying to detect fatty liver. But here's the problem. Most doctors, especially in quick routine appointments, don't order these tests unless there's a significant elevation in enzymes or very obvious symptoms. They follow old protocols, outdated guidelines, and end up missing diagnoses that could be made early. And here's a piece of information that will surprise you even more. Recent studies have shown that in patients over 50, especially those with insulin resistance, metabolic syndrome, or a family history of diabetes and liver problems, the prevalence of fatty liver disease is over 40%. This means that almost half of people in that age group have fatty liver. But the vast majority don't know it because they've never had the right test. And even worse, many of these cases are silently progressing to steatohepatitis and fibrosis because no one is intervening in time. This is a silent epidemic happening right under our noses, and the main reason is that the healthcare system is still stuck in outdated diagnostic methods. Now you might be asking, but if I find out I have fatty liver, what do I do? How do I reverse it? And the good news is, yes, it's absolutely possible to reverse fatty liver, even in advanced cases, as long as you haven't reached established cirrhosis. The basic protocol involves profound dietary changes. It's not just cutting out a little treat here and there, but truly restructuring how you eat. You need to eliminate or drastically reduce refined carbohydrates, added sugars, white flours, and ultra-processed foods. These are the main culprits that fuel fatty liver. Boost your intake of vegetables, quality protein, and healthy fats like olive oil, avocado, and nuts. Incorporate foods with liver protective properties such as broccoli, kale, garlic, turmeric, and green tea. And here's a crucial detail many people overlook. It's not just about what you eat, but when and how much you eat. Intermittent fasting, for instance, has shown remarkable results in reducing liver fat because it gives your liver a metabolic rest period where it can start mobilizing and burning accumulated fat. Beyond diet, physical exercise is absolutely fundamental. And it doesn't have to be anything extreme. You don't need to become an athlete overnight. Studies show that walking 30 to 40 minutes a day, 5 times a week, is enough to start significantly reducing liver fat. Exercise improves insulin sensitivity, helps the body process glucose more efficiently, reduces systemic inflammation, and stimulates the liver to metabolize stored fat. If you can add some resistance training, light weightlifting, or bodyweight exercises, the results are even better. But the most important thing is consistency. It's about making it a daily habit, not something you do for 2 weeks and then abandon. Now, let's talk about supplements, because many people ask me if there are any supplements that truly help, and the answer is yes. There are some with solid scientific evidence. Vitamin E, in appropriate doses and under medical guidance, has shown benefits in reducing liver inflammation. Omega-3s, especially from marine sources, help lower triglycerides and have an anti-inflammatory effect on the liver. Berberine is a natural compound that improves insulin sensitivity and helps reduce liver fat. Alpha-lipoic acid has potent antioxidant properties that protect liver cells. But be aware, supplements don't work miracles on their own. They are a complement to a proper diet and exercise, not a substitute. A question that always comes up is, how long does it take to reverse fatty liver? And the answer varies greatly from person to person. It depends on the degree of fat accumulation, how long you've had the problem, your adherence to the protocol, and your individual metabolism. But on average, by following a rigorous diet and exercise protocol, you can start seeing significant reduction in liver fat in 3 to 6 months. In milder cases, sometimes even less. In more severe cases, it might take a year or more, but the improvement is progressive and constant if you maintain your commitment. And here's something comforting. The liver is one of the most regenerative organs in the human body. It has an extraordinary capacity to heal itself, to rebuild itself, as long as you give it the right conditions. Let me tell you now about Maria, a patient who is living proof that reversal is possible. Maria is 65 years old and was diagnosed with grade 3 fatty liver 2 years ago. When she came to see me, she was scared, thinking she was doomed, that she would need a transplant, that there was no hope. But I looked her in the eye and told her there was still time, that she had everything to reverse the condition if she was willing to change. And she did. She cut out sugar, white flour, processed foods. She started walking every day, made intermittent fasting a lifestyle, and began taking the right supplements. In the first 3 months, she lost 18 pounds, her belly deflated, her fatigue decreased. In the follow-up ultrasound after 6 months, the fatty liver had reduced to grade 1. Today, 2 years later, she practically has no more fat in her liver. Her enzymes are perfect, and the elastography shows no fibrosis. Maria has regained her energy, feels alive again, and has hope for the future. And if she could do it, so can you. But now I need to warn you about something very important. There are many myths and misinformation circulating about fatty liver, and I don't want you to fall into these traps. The first myth is that fatty liver is only caused by alcohol. False. The vast majority of cases nowadays are non-alcoholic fatty liver disease caused by a poor diet, insulin resistance, metabolic syndrome, and a sedentary lifestyle. You can have never had a drop of alcohol in your life and still develop severe fatty liver. The second myth is that only overweight people get fatty liver. Also false. There are many thin people with seemingly normal weight who have fatty liver because they have what we call metabolic obesity, meaning visceral fat accumulation and insulin resistance even without visible overweight. The third myth is that if you don't feel anything, it's not a problem. Completely false. Fatty liver is silent most of the time. You can have an advanced stage and feel absolutely nothing until you start developing serious complications. Another common question is whether medications can cause or worsen fatty liver. And the answer is yes. Some medications have a hepatotoxic effect and can contribute to fat accumulation. Corticosteroids, certain antidepressants, some diabetes medications paradoxically, and even chronic anti-inflammatories can affect the liver. This doesn't mean you should stop taking your medications, but it's important to talk to your doctor about alternatives if you already have fatty liver or are at risk of developing it. Never, ever stop medications on your own, but have this open and honest conversation with the healthcare professional who is looking after you. Let's talk now about the connection between fatty liver and diabetes because they go hand in hand. Insulin resistance, which is the condition where your cells stop responding properly to insulin, is both a cause and a consequence of fatty liver. When you have insulin resistance, your body produces more and more insulin to try to force glucose into your cells, and this chronic hyperinsulinemia stimulates the liver to produce more fat. At the same time, the fat accumulated in the liver further worsens insulin resistance, creating a vicious cycle that eventually leads to type 2 diabetes. That's why it's so important to treat fatty liver before it progresses to diabetes, because once you develop diabetes, treatment becomes much more complex and reversal much more difficult. Let me give you a practical summary of everything you need to do starting today. First, if you are over 50, have a prominent belly, feel chronically tired, or have a family history of diabetes or liver problems, ask your doctor for an abdominal ultrasound with liver evaluation. Don't take no for an answer. Push for answers because you have the right to know what's happening in your body. Second, even if your liver enzymes are normal, that doesn't mean your liver is healthy. Third, if you find out you have fatty liver disease, don't panic, but don't underestimate it either. It's a serious issue, but completely reversible if you act now. Fourth, implement drastic dietary changes. Cut out sugar and refined carbs, increase vegetables, and quality protein. Fifth, start exercising, even if it's just a 30-minute walk a day. Sixth, consider intermittent fasting and appropriate supplementation under guidance. Seventh, get follow-up tests every 3 to 6 months to monitor your progress. If you have fatty liver and are struggling to reverse it, if you've tried everything and nothing has worked, or if you've just discovered it and are scared, I want you to hit that like button on this video right now. That like isn't just a gesture, it's you saying you're committed to your health, that you're willing to fight, that you won't give up. And share this video with someone you love, because I guarantee you know someone going through the same thing, someone being underserved by the healthcare system, someone who needs to hear this information. You could literally save someone's life by sharing this knowledge. Before I wrap up, I want to leave you with a final message. I know it's scary to find out something's wrong with your body, that you have a condition that could progress to something serious. I know it's frightening, that feeling of powerlessness, that maybe it's too late. But I'm here to tell you, it's not too late. As long as you're alive, as long as your body is still functioning, there's still time to change, to reverse it, to heal. The liver is an extraordinary organ. It wants to heal. It's waiting for you to give it the right conditions. And I'll be here, video after video, guiding you on this journey, giving you the tools, the knowledge, the support you need. You are not alone in this fight. There are thousands of people watching right now who are going through the same thing, who understand your pain, your fear, your determination. And together, we will win this battle. In the next video, I'll show you exactly how to put together a complete eating plan to reverse fatty liver, with sample menus, recipes, and practical tips you can start applying immediately. So subscribe to the channel, hit that notification bell, and I'll see you soon. Take care of yourself, value yourself, and remember, your health is the most precious asset you have. Until next time.